Hey everybody, welcome to our last lab video for AP number 1. Today we're going to be working on muscles that move the inferior appendages. We're going to be looking at muscles that move the hip joint, the knee joint, and the ankle joint. We're starting with the hip joint. We're going to knock out 5 muscles that flex the hip. Of course, a flexion of the hip is a decrease in that hip angle. The 5 muscles we're going to do are the psoas major, the iliacus, the rectus femoris, the sartorius, and the tensor fasciae lati. Starting with the psoas major, find the kidney right underneath. That is the psoas major. Kind of big cylindrical muscle in that posterior pelvis and abdomen there. That is the psoas major. It's going to flex that hip. If we switch models, find the kidney. Cylinder next to it, underneath it. That is the psoas major. So that is a nice psoas major right there. Look at that psoas major right there. And now nearby the psoas major, our second muscle that flexes the hip is the iliacus. Sitting in that iliac region of the hip bone, that is the iliacus, this fan-shaped muscle here. So there's the psoas major right there, psoas major and iliacus. Iliacus is right here. Look at that nice iliacus, and there's the psoas major right there. All right, our next hip flexor is this big anterior thigh muscle called the rectus femoris, the straight muscle in the femoral region. This is what its name tells us. This muscle is kind of unique in that it is going to act on 2 separate joints. It flexes the hip and extends the knee. So we're going to come back to this muscle later. It is going to originate on the iliac portion of the coxal bone and insert down onto the base of the patella. So that is the rectus femoris. The next muscle we've got, which is a neighbor of the rectus femoris, and we can see the rectus femoris right here, of course, is the sartorius. It is this long, ribbon-like muscle extending from the anterior hip down into the medial knee. That is the longest muscle in your body, in fact, and it is called the sartorius. The word sartorius refers to a tailor, like someone who's sewing for a living, because typically, like back in old-fashioned times, tailors would sit in like a crisscross applesauce style as they did their craft, and the sartorius helps you get into that position. So there is our rectus femoris right there. Look at that rectus femoris, and right next to it there is the sartorius. All right, we got a very muscular lady right here. She's been hitting the gym. Awesome for her. Look at her nice rectus femoris right there. Fantastic rectus femoris. And of course, if you saw this lady walking down the street, you would think, dang, she's pretty muscular. But now you would also notice, you'd be like, holy moly, look at that sartorius. I mean, look at that sartorius just popping out at us right there. Most normal, regular folks do not have a sartorius like that. I know I don't have a sartorius like that. But good for her. She's kicking butt. All right. So let's do another hip flexor. It is this muscle kind of in the front pocket area. It's called the tensor fasciae lati. Tensor fasciae lati. Fasciae lati refers to the wide bit of connective tissue that it's going to pull upon right here. We'll name this later. So this muscle is going to flex our hip. And because it's on the side as well, it also pulls the femur out, so it's an abductor. So there's the tensor fasciae lati. Do notice that the tensor fasciae lati, the rectus femoris, and the sartorius are all neighbors right here. That's why they're synergistic in their actions. If we look at this muscular lady, we can also see her tensor fasciae lati popping right there. And lots of other muscles as well. You should be able to identify this muscle, that muscle, that one, that one. Those are all muscles we did in the last video. So go ahead and pause this and knock all those out. Giving you some extra work there to do. And now let's move on. We're done with flexing the hips. Now we're going to extend the hip. Notice, as always, our flexors were in the front because the motion of flexion was to the front. And our extenders are going to be in the back because the extension motion is to the back. And extension is an increase in the angle, the joint angle. So there are three extensors. There's the gluteus maximus, the gluteus medius, and a group of muscles called the hamstrings. We're going to hit the gluteus maximus now. Then we'll come back to the gluteus medius and the hamstrings in a bit as they do other things. Gluteus maximus, as its name suggests, is the big butt muscle. It is going to extend the hip. See the gluteus maximus posteriorly and laterally right here. If we look at this gentleman right here, we can see his developed gluteus maximus muscles right there. All right, let's talk abduction. So where the femur is going out. We're going to have two muscles that abduct the hip, the gluteus medius, which also extends the hip, by the way, as well as the tensor fasciae latae. I forgot to put the word latae. Let me add it right here, latae. So we cannot forget that word. There it is, the tensor fasciae latae. Now we can continue and knock out these two muscles. So we did the tensor fasciae latae earlier. We're going to do the gluteus medius right now. You might look at this and wonder what the heck is going on, but if we go back for a second, see this gluteus maximus? What if we ripped it off? We're going to take this piece off. When we take that piece off, then underneath, deep to the gluteus maximus, we see the gluteus medius, which is an abductor and extensor of the hip. It is going to originate up on the iliac part of the coxal bone and insert onto that greater trochanter of the femur. So pretty good muscle right there. Here we see it again right here. That is that gluteus medius. All right, now let's talk about adducting the hip, where we're going from a position away from the midline and we're moving the hip inward, moving the thigh inward, more towards the midline. And we got three adductor muscles. They are the adductor longus, the gracilis, and the adductor magnus. Those are the three. So let's take a look at them all. I'm actually going to jump to and do gracilis first because gracilis is my favorite here. Gracilis is my favorite because it's so easy to find on that medial inner thigh here. It is so very vertical right there. It comes down and meets the sartorius. So you go to the bottom of the sartorius and you find the gracilis. Ever so vertical, ever so much in the middle. So there's the gracilis. Once I find the gracilis, if I go right in front of it, I find my adductor longus. Nestled right in front of it. Of course, adductor means it's going to adduct the hip. So gracilis first. The word gracilis, by the way, means slender or graceful. So that is the gracilis. That is the adductor longus. And then if I go this way, if I go behind the gracilis, then in there do I find the adductor magnus. So that trio right there, look at the three of them. Three synergists sitting in a row. All right, cool. Let's look at them again here. So look, there's that sartorius, bottom of the sartorius, and we shall find the gracilis. This is the gracilis. I'm drawing a blue line on him. Right in front of him is the adductor longus. I don't see my adductor magnus in this view because I'm not posterior enough. Here is my gracilis in the posterior view, and there is my adductor magnus right there. Okie dokie. Let's now do the hamstring group, because the hamstrings, we mentioned them earlier, they extend the hip, they also flex the knee. The ham part refers to the back of the knee strings because we got tendons back there. And this is a group of three muscles that are going to flex that knee. And oh, by the way, notice that this is the one time where flexion is not towards the front. Flexion is towards the back here. Okay, these are my 3 hamstrings. There's my biceps femoris. There's my semitendinosus. And then under him is my semimembranosus. I got 2 arrows on my membranosus. There's my tendinosus, and there's my biceps femoris. This trio of muscles here is my hamstring group, and they will flex the knee. All right. Let's check out that biceps femoris. Although it is not visually apparent right here, it is a 2-headed muscle. It is going to originate in 2 places because of that. The ischiotuberosity of the hip bone or coxal bone, as well as that linea aspera of the femur. And then it comes down and it grabs onto it, inserts upon the head of the fibula. So remember, the biceps femoris is this very lateral muscle of my hamstring group. So there's my gluteus maximus. If I walk down the gluteus maximus to its pointy part, then right next door I meet the biceps femoris. And if I go right next to my biceps femoris, I find my semitendinosus also flexes the knee and extends the hip. The semitendinosus sits on top of a muscle called the semimembranosus. We see it peeking out medially, peeking out laterally. That is the semimembranosus. And those are my 3 hamstrings. I see them all again here. Check out the biceps femoris. There it is, the lateral hamstring. Look at it right there. Then once I find the biceps femoris, I go right next to it. And there is my semitendinosus. It's on top. Then underneath it, peeking out on both sides, I see my semimembranosus. Look at that little line right there. You see that? As well as right there. That's the semimembranosus. So make sure you can find all 3 of those guys. Looking at it from the lateral view, I nicely see the biceps femoris there, and I see my semitendinosus as well. All right, let's now do extension of the knee. And it is another group of muscles here. We got a group of 4 muscles appropriately called the quadriceps femoris. And extending the knee, of course, is increasing that angle, straightening that knee joint. So, anterior thigh right here. This is where I'm going to find my quadriceps femoris. I saw the rectus femoris earlier. I met him. He is right here. That is my rectus femoris. And then you can probably guess this is my vastus lateralis and this is my vastus medialis. The vastus intermedius is not visible in this anterior view because it is a deep muscle. All right, let's look at all 3 of these guys one at a time. There's that rectus femoris. We met him earlier because he was a flexor of the hip as well as an extensor of the knee joint. He originates on the iliac part of the coxal bone and inserts on the base of the patella. Medially to him, there is the vastus medialis. The word vastus means big. Medialis on the medial side. It's another extender of the knee. And if we jump to the outside, we got our vastus lateralis there. And if we keep on going, we take a look at the lateral view. We see the vastus lateralis in the same spot, but notice it is also tucked back here. Sneaky instructor will put the tag like right here on vastus lateralis just to throw you off. And so here is some connective tissue running on top of it. This is called the iliotibial band, which runs from your hip bone down to your tibia. So make sure you know that as well. Okay, I took off the rectus femoris here to show you the deep vastus intermedius underneath it. It is our 4th and final member of the quadriceps group. And let's switch models. What is this muscle right here? I'm asking you questions now. I'm switching things around. What is this muscle right here? And what is this muscle right here? So do those 3. And I could ask you about a bunch more, couldn't I? Oh, I certainly could. All right, do those 3. If you get stuck, let me know. All right, muscular man here. Let's check out his thigh muscles. What do we have right here? That is his rectus femoris. Did you say rectus femoris? I gave you time to say it. I hope you did. What do we have right here? Nice teardrop shape to it. What is that? That is his vastus medialis. And then finally, last but certainly not least, what do we got right here? That is his vastus lateralis. All right, good work. If you got all 3 of those, good on you for that. Okay, hey, check this out. We're almost done. We just got to do the ankle. And we're only going to do 2 ankle movements. There is plantar flexion, which is pointing your toes, and dorsiflexion, which is pointing your toes up. There are 2 muscles that are plantar. They're going to plantar flex the ankle. They are the gastrocnemius and the soleus. Here is the gastrocnemius, the big calf muscle here. Points the toes, so it plantar flexes the foot and ankle. So if you go up in your tippy toes, you're plantar flexing, and you are using your gastrocnemius. It is going to originate on the medial and lateral condyles of the femur and insert down on the calcaneus via the calcaneal or Achilles tendon. Okay, there's the gastrocnemius from the side view, ever so nice. There's that calcaneal tendon down there. And there's that calcaneal tendon again, leading me up towards the 2 bellies of the gastrocnemius. Gastrocnemius literally means belly of the leg, by the way. All right, if I find the gastrocnemius and I go right under it, that's the soleus, sharing that calcaneal tendon. The soleus is a very thin muscle. In fact, that's what the word soleus means. It means thin or flat. And it is also a plantar flexor. If I look at this muscular dude here, notice his heels are up, so he's plantar flexing. So I nicely see his gastrocnemius and his soleus here, as well as his Achilles tendon or calcaneal tendon. Which do you like better, Achilles tendon or calcaneal tendon? I personally like Achilles tendon. I like that nod to Greek mythology there. Okay. On that note, we got one more muscle to do, guys. And that is our dorsiflexor. Dorsiflexion is pulling your toes up. And our muscle that does that is the tibialis anterior. So find the tibia, right next to it, tibialis anterior. Find the tibia, right next to it, tibialis anterior. Could it get any easier than that? I don't think so. Tibia, tibialis anterior. Piece of cake, right? And we're ending on that easy note. Again, we got through these muscles in less than 20 minutes. So I feel very accomplished in doing that. Hopefully you watched this whole video. I mean, if you're listening to this part, I guess you did. Good for you for doing that. Good luck on your test. Make sure you know all these muscles, their actions, their synergists, their antagonists, when necessary, their origins, their insertions. Find them on the plastic model and on a human man or a human woman. On that note, see you later. See you in AP2. Bye.